All right, today we're going to be talking about peripheral vascular disease, or your PVD. This is finishing up chapter 25 in TIMBY. Peripheral vascular disease is a condition that affects primarily the blood vessels that supply oxygen to your lower limbs. Common examples would be PAD, Raynaud's disease, thrombosis, or an embolism. PAD, or peripheral artery disease, is when the blood flow is restricted and manifestations of ischemia to the tissues occur. Men are more affected than women, and it is usually in the lower extremities. Some signs and symptoms: they could have intermittent claudation, which is pain and cramping in the thigh, calf, or buttocks during activity. Their extremity could be cold to the touch. They could be experiencing numbness or heaviness. You will see that the hair in their toenails growth is slowed. The legs can appear red in a dependent position, but return to normal when they are elevated. Some complications are your critical limb ischemia. You can also have characterized by open sores or infections that do not resolve. So they're not getting that blood flow to have that healing process. So they become gangrenous. This is threatening the viability of the limb, which could lead to amputation. Nursing management is we're going to monitor the peripheral pulses. And remember, we always want to compare them to the other side. So we're going to monitor them and check them at the same time. We want to assess their skin. Are there any open wounds? Is anything different? How do they feel? We want to also make sure that they understand daily foot care. Remember, they're going to be having some numbness, so we need to make sure that they're looking at their feet daily. We also want to teach them not to apply direct heat. We don't want to apply heat. We also want to avoid positions that interfere with blood flow. The most common one is crossing their legs. Raynaud's disease is localized intermittent episodes of vasoconstriction of the small arteries of the hands and feet. The hands are the most common. Signs and symptoms that you're going to see is pallor, coolness, and cyanotic. This primarily affects young women. With Raynaud's, they can turn a white looking to a blue or a red when the blood flow finally goes back to returning. So nursing management, we're going to try to avoid that vasoconstriction. So we're going to keep our hands warm and free from injury. When they're outdoors, we want to suggest they wear gloves. Also in air-conditioned places, or when they're handling cold food. We also want to avoid stressful situations, and some lifestyle changes we want to talk about is smoking and coping. So smoking and coping, that can also cause that stress, which can vasoconstrict. Thrombophlebitis is the formation of a thrombus associated with vein inflammation. They can be superficial or deep. If a detachment occurs, that's when you get that emboli, which can travel through the veins to the heart and the lungs. Some things with superficials: they are palpable, firm, and cord-like veins. Surrounding area can be warm, red, and tender. Edema may or may not be present and is often related to varicose veins. Deep is a unilateral edema. Pain, the skin is warm, and an elevated temperature. This is the one where you have that Homan sign, pain on dorsiflexion of the foot. Do we perform this? Hopefully you all said no. Remember, this goes back to that it could dislodge that clot. We do not want to dislodge a deep vein thrombosis. Nursing management, we have talked about this a few different times. We are going to provide pain relief We're going to elevate the leg higher than the heart to promote venous drainage. We're going to apply warm, moist compresses. Remember, we are never going to massage. We do not want to dislodge that clot, so we never massage. Monitor the limb circumference. We want to make sure that limb is getting smaller and not larger. Also, prevention, using compression stockings, avoid prolonged standing or setting, and avoid restrictive clothing. That is some ways to prevent. Venous insufficiency is an inadequate venous return. This can have edema of the lower extremities that may extend up to the knees. There is thick, coarse, brownish skin around the ankles and feet, and ulcers may be present. Nursing management, we want to provide bed rest with legs elevated above the heart. We're going to suggest they do this for 20 minutes, 4 times a day. And every time when they're laying in bed, we always want those extremities elevated. We want to avoid long periods of standing. We want to encourage compression hose and avoid thigh restrictive clothing. So we don't want anything restrictive on them. Varicose veins is a vein or veins in which blood had pooled, producing distended palpable vessels. So that blood is pooling. Risk factors are women over 35, obesity, if there's a family history, or if you have a prolonged standing job. So if you're standing for a long length of time. Signs and symptoms are aching, heaviness, itching, and swelling in the leg. We want to apply compression hose, and we want to elevate the feet when they're lying down. An abdominal aortic aneurysm, or an AAA, or a AAA, it is a localized dilation or outpouching of a weakened area in the aorta. Large aneurysms tend to rupture, which can be life-threatening. Why is that? What exactly does our aorta do? So think back to our diagram of the heart. Where is the aorta? So if you remember, the aorta comes off of your left ventricle. So our aorta is what's sending blood to the rest of our body. So why could that possibly be life-threatening? Are we getting any blood return back to the heart? A major risk factor is atherosclerosis. Signs and symptoms, they could be asymptomatic. They could report feeling a heartbeat in the abdomen when they're lying. They could feel possible a pulsating mass. We do not want to palpate that. We don't want to take the chance of rupturing it. They could also complain of abdominal or back pain. Patients with an abdominal aortic aneurysm, we need to make sure we're controlling the blood pressure. We're going to monitor the blood pressure, and we want to make sure they're taking that medication as ordered. Some signs and symptoms of an impending rupture can be pain, tachycardia, pallor, and sweating. So just things we're going to watch for to make sure they're not at risk for that rupture.